Today we have Washington State Representative My-Linh Thai representing the 41st Legislative District, which is King County in the state of Washington. Welcome, Representative Thai.
Thank you, Irene. It's good to see you.
Good to see you too. I'm hoping I can ask you some questions about COVID-19 and how it's impacted you and your community. I understand your husband, he's a first responder, how that has been.
He's actually trained as a neurologist, and so he ended up seeing patients who having neurological symptoms, but also having COVID. As we know, as the more we know about this particular impact of COVID-19 neurological issues for patients who experiencing or having the being infected by this virus is prevalent. So he ended up seeing some of his patient populations with those who being infected by COVID-19. Yes.
Right. And what about in your district or in King County or in Washington? How has COVID-19 impacted your community?
Oh, just like many community, Irene, I think it's, as you know, the first case in the United States that made the news was actually only a few community away from mine. It was in Kirtland, and I live in Bellevue. We pretty much neighbor cities. And that happened while the legislation was in session. So it's it has been quite a ride for many of us. King County, as you mentioned, is the most populated, high density county in Washington state. At the same time, the Department of Public Health is also a pretty strong public health system in Washington state. And so I think we managed to handle COVID-19. If I have to give it a grade, I would probably give it a C. We didn't fail miserably, but at the same time, I wouldn't say we got it at the get-go. So there are quite a few learning curves that we experience here in my community.
Can you speak a little bit more about the successful policies as well as some of the policies that didn't work? What earned a C?
You know, I would say what I felt strongly was part of the success stories was in the sessions of 2019. We passed legislation to increase significant funding in two areas. Area number one is to build the foundational public health for Washington state, recognizing that that's how we can keep our community safe, and that's how we can keep our community healthy. And I think that is the basic foundation for building community forward, is to ensure that there's people have an educational opportunity and ensure that their health care is being provided and taken care of. The second investment in 2019 that Washington State Legislature did was to fund significantly toward the mental and behavioral health system. Not only in terms of creating more clinics and mobile clinics for mental and behavioral health, but to fund for training and making sure that the workforce are available in this particular area. And then 2020, COVID-19 happened. I wouldn't say that was enough to prepare, but at the same time, we started to build that capacity, and especially in public health system. So we were able to respond to COVID sooner. I would attribute that to part of the success. Secondly, we have the conversation way early before we know a case in our state. We talked about the situation happening in China in terms of geographic proximity. We were thinking, how are we going to make sure that, because we knew this is an infectious disease as by nature, how would we prepare ourselves? And so school closure, very early, as soon as session end, we announced school closure. We knew the populations that being impacted would be those who are experiencing homelessness. So we put significant prioritizing where we wanted to build capacity is the capacity to shelter people. So those are probably a few I would attribute to the success story. The not so success is that we counted on, and we believe this would be a national, global. At the time, it wasn't named a pandemic yet. So we were hoping that at the national level, we would have sort of sweeping response, that it would not rely only in our state. So when legislature ended, we voted to fund, I wish that we would have voted to fund a larger amount that would allow the state government to ensure a lot of services still running and building in the capacity to support what would have been now 6 months into our pandemic. Because we couldn't foresee how the national level would respond to COVID-19. So I would say that is a piece that as a state legislator, I regret the lack thereof coordination between our state and our national level.
Has economic activity resumed in Washington? And if not, what is needed to resume that activity?
It has resumed slowly. You may know the governor put forward 4 phases with the working closely with the Department of Health. And based on data coming out from University of Washington, in parallel with many of the local public health data. We started out with phase 1, so I can speak specifically to King County. King County was one of those counties that it didn't really fit phase 1, 2, 3, or 4. So we started with phase 1, and we started seeing that the trending of cases was not in favorable, moving into phase 2. At the same time, like you say, there's a need of certain economic activity to be resumed. Part of it is because Washington State is one of those states that have a very regressive tax structure. The state revenue depend heavily on sales tax. And so when these activities are not resuming, then the revenue for state significantly, basically we cut that off. We didn't have any revenue. So we built into the space where flexibility happens. So King County, instead of move to a phase 2, we move it into a phase 1.5. And within that space, we continue to put the health of our people as our top priority. So at this point, King County is in phase 2, but the trending continued to goes up as far as the number of cases. So Governor Inslee have put out a proclamation to pause, because when these phases were being introduced, we was thinking of moving from one phase to another within a 3 weeks period, pending on information on data, and Governor Inslee decided to pause at first 2 weeks, and now we put another pause for 3 weeks since our trending continued to go up in numbers of cases.
So according to Stop AAPI Hate, there have been over 2,000 incidents or reports of hate incidents against Asian Americans in the wake of COVID-19. What have you seen in King County?
We are not different than what we've seen at national level at any of the other local state. In my own city, in the city of Bellevue, the police department put forward a specific website dedicated to reports of these incidents. And Washington State is one of the states that have in our statute the language of hate crime and incident of hate crimes. And because it's in our statute, it's really helped law enforcement officers and in terms of putting forward reporting system, since we have many of those policies in place. And we are working through these cases partially because the court system are in shutdown as well. And so we're working with local communities and nonprofit organizations to ensure that number one, public education is being putting forward in parallel with reporting, and number two, we want to make sure that our law enforcement officers are being trained in this area as well, so that when they respond to these incidences, it's about the escalation and giving opportunity for people to understand the impact of their behaviors.
Okay. Worldwide, people have seen the death of George Floyd and the resulting protests. How has Bellevue or King County reacted?
Well, I imagine worldwide would also get to know Seattle in another side of Seattle through what started out as CHOP and eventually has become jazz, and now it's not barricaded. Still, the East Precinct Police Department is not in full function. It's still kind of closed its door. I think we responded like many other places. First of all, in terms of disbelief, but at the same time, it's really highlighting the racist system that the United States of America is functioning in. And it's also highlight so much of the conversations that been going on, especially those who've been fighting for human rights and civil rights in the United States, specifically wanted to highlight the work around and the conversation around race in America. I don't think we have the answer. I know that the call to defund police with very much daily protesting in Seattle, and across King County is evident. In my own city in Bellevue, our students has been the leaders in this work, and I cannot tell you how proud I am. As you know, before this role, I served as school board director, and meeting with them and hearing their stories, and now seeing them being the leaders, leading in the work that ensuring their school environment is a place where they get to thrive, not a place where fears would occupy their mind and block them from the opportunity to learn. So I stand with them and I support them. I can share with you also is that the Washington State Legislature, at least in the House D caucus, we are having conversations specifically around tackling the racist system that we are in, and really to start with cleaning our own house. Literally, and the speaker have asked for a racial equity council that would aid her and the caucus in the work ensuring that we will not perpetually upholding the racist system that we are functioning in, especially in the body that would legislate policy which impact millions of people.
So has the Asian American and Pacific Islander community joined in with Black Lives Matter in your state?
Yes, most definitely. And that's another point that I'm really proud of, being an Asian American legislators. Our community really showed up in strong force and made us really proud.
Thank you. So the current COVID-19 pandemic and Black Lives Matter movement has changed the state of the world drastically. What do you think is required of the United States and of the world going forward?
Like many problems, and I think I'm gonna try to articulate it as through the lens of a healthcare provider. So when we are being faced with many symptoms, one of the pieces is to look at, to listen to the symptoms, to believe that these symptoms exist. When a patient's telling us that they have these symptoms, and trust the patient's stories, which speak to the concept of being aware. And then the next things is to be able to analyze the data, looking at informations, looking through a set of informations that we already have, and create what we call, in the healthcare, we call differential diagnosis. Now, I'm talking about this as for those who do not already believe that racism exists. And they exist in many different areas. Colorism is another piece. And I think for us Asians, we continue to see those with darker skin tone as laborers, as working class, and those with a fairer or lighter skin tone as educated class. So not only colorism, classism exists in the globe, in the world. And in the United States, we see it as racism. And once we would be able to make a diagnosis, whether it's being called racism, whether it's being called classism, whether it's being seen as colorism, all of those isms need to be identified and then figure out the treatment. And the treatment cannot happen until we recognize and accept that is the case. Those are the problem and the issues that we need to resolve. And COVID-19 just break open any band-aid that being put on, or any cover that being put on, in order for us to ignore these issues that has been plaguing our communities for generations. And so my hope is that this would help us move forward, so that we would be a more inclusive community, whether we're looking at national issues or global issues, that we can actually coming together and see each other as who we are. Because if we don't, we continue to lose talent, right? We continue to create all these barriers that people who has so much potential simply because of their skin colors could not advance and could not contribute their talents to the capacity of building a better world for the next generations.
Thank you. So what are the overall challenges you anticipate for the 2021 legislative session?
Definitely budget. I think that will probably be the biggest issues that we will face, and I don't know. I'm an optimist in general. There's no problems that we cannot resolve when we come together with one voice, clear priorities, and bring our people together. Part of being optimistic in terms of my own personalities, because I think being a refugee in this country gave me that lens, right? Coming to this country without root, without sort of any knowledge of the language itself or knowledge of the system itself, I just kept working at it and have a belief that if you worked at it, you solve any issues or problems that we face. And if I could do it with 98 others amazing colleagues of mine in the House, we can do it too. And so I think coming into 2021, I continue to use that same foundational sort of values base that I have been using, is that I come at every issues to tackle with love. And if I love my people enough, that love will conquer all kinds of problems. We solve it.
Well, thank you. Thank you so much. Thank you for joining us and for sharing your thoughts today, Representative Thai.
Well, thank you for giving me an opportunity to share with you what's going on in Washington. I hope that there are other legislators that would take on these opportunities and share with each other what we've learned and the challenges we're facing. And I also hope that we don't have to stop at our borders, whether it's state borders or nation's borders. I think at one point we got to see the humanity in all of us. And I think that is when we can truly be in the globalizations of breaking down all barriers.